you. And last up is Avik Roy, who is a senior fellow with the Manhattan Institute, who has actually been bouncing around from forums like this one after another for the last couple of days. So we're glad to have him here. I have to tell you, he is one person whose blogs and columns I make sure I read every day just about. They seem to come out, and they always have real boring in-depth into the law in ways that, finding new stuff in there. I've read all 2,500 pages, so if you haven't read all 2,500 pages, you'll really get something out of his digging on that. He is also significantly an advisor to the Romney campaign on health care, and God knows Mitt Romney can use all the advice he can get. So in that point, we're happy to have him with us, and I'll turn it over to you.
And he meant boring in the sense of drilling down. That's what he meant.
Valuable.
I think he meant it in both ways, or at least it would be accurate for him to have meant it in both ways. Well, thank you for having me here. I should disclose, since Michael was kind enough to mention my affiliation with the Romney campaign, that I'm an advisor to the Romney campaign. Governor Romney gets advice from many people, and I do not speak for the campaign. Having said that, I'm very glad to be here. The Cato Institute has been at the forefront of opposing the individual mandate from its earliest days, not too far from here in Washington in the 1990s. And it's an appropriate day to have an event like this. I'm here to let you in on a little secret. The individual mandate is too weak. The individual mandate in Obamacare requires that every American, with some exceptions, buys health insurance or pays a fine. And I don't subscribe to the idea that it's a tax, it's a fine. That fine maxes out at $695 per year, or 2% of your, or 2.5% of your adjusted gross income. Now, remember that the average health insurance policy for a family in America in the private market costs $15,000 a year. And now, thanks to Obamacare, as the President reminded us last week, you don't have to have insurance to get care, because if you get sick, you now have a pre-existing condition. You can go to the hospital, buy insurance that day, and the insurance company has to accept you. And so if you have a choice between spending $15,000 on a health insurance plan or $695 to get all the same care as someone who's insured, which will you choose? I think the choice is clear. And this really gets to the heart of what Obamacare is, and what I think, because of all the controversy around the constitutional challenges and some of the other related aspects of the law, has been completely missed in this law. And that is that this law will massively drive up the cost of health insurance in the private market, effectively destroying the private health insurance market unless significant reform takes place in the ensuing years or repeal. What it comes down to, in essence, is that Obamacare inverts the laws of health economics. And the key principle to understand here is called adverse selection. So what happens in insurance is, let's take the example of homeowners insurance. So let's say you have two people who own homes of relatively equal value. One person lives in a neighborhood where a lot of arson attacks take place. Another person lives right next to a fire station in a town or a region of a town with low crime. Those houses are of the same value, but one is of lower risk than the other in terms of the risk that that house will burn down. Should they both pay the same for their homeowners insurance? Classical economic theory would be that they shouldn't, that the person who lives in the higher risk area, where he has a higher risk of arson, should pay more for his insurance than the person who lives next to the fire station in the safe area. And it's not merely a matter of morality, it's a matter of economics. If I live in the home next to the fire station and you ask me, well, you have to pay as much for your health insurance or your homeowner's insurance as the person who lives in the arson zone, I'm going to say, you know what, that's not a good deal for me. I'm going to pay a lot more for my insurance than the actual risk that my home is going to burn down, I'm out. I'm not going to buy that insurance plan. And that's what creates adverse selection, because what ends up happening is only the people who live in the arson zones buy the insurance, because their average expense or their average claim is much higher. The cost of insurance goes up because insurance is a way of averaging out the overall expenditures for the whole group. Insurance continues to get progressively expensive. People who are in progressively safer but also moderately risky areas opt out. It's a bad deal, and the insurance market goes away because it's unaffordable for everyone. That's exactly what Obamacare will do in the private insurance market, because the Americans who will be forced to pay this mandate fine know that it's a better deal for them to pay that fine than to buy insurance. And that's not the only aspect of Obamacare that accelerates the adverse selection problem. The law does something called community rating, which forces young people to pay as much as 75% more for their insurance, so that older people will pay slightly less for theirs. The law has these coverage mandates. Every insurance plan must cover contraception. Every insurance plan must cover drug abuse. So it has all these things that maybe you won't need, but you will have to pay for. It's like going to the restaurant and being told that you're going to have a 7-course meal, even if you only wanted 4 courses and don't really like seafood. So that's kind of the economics we're talking about. All these benefits sound great. Oh, every insurance plan will have to do this. Every insurance will have to do that. But every single one of those requirements, those mandates, drives up the cost of insurance. And everything that makes insurance more expensive makes it a raw deal for the young people who are uninsured today. This is the key thing about the uninsured population. The uninsured population is predominantly young. 55% of all the people in America without insurance are under the age of 35. 72% are under the age of 45. These young and healthy people don't buy insurance because government regulation makes insurance too expensive for them. A CBO did a study, the Congressional Budget Office did a study a few years ago asking, why are people uninsured? They're uninsured, 71% said it was because of high cost of insurance. 62% said because their employer didn't offer it or they were unemployed. Only 4% said that it was because of their health status, or they were getting rejected for insurance because of health status. The vast majority of people who are uninsured are not uninsured because of pre-existing conditions. The vast majority of people who are uninsured because insurance is too expensive. And insurance is too expensive because of government policies that drive up the cost of health insurance. And Obamacare is Exhibit A. It does everything precisely almost as if it were pre-designed to destroy the private insurance market. So that is the first problem you have to understand about Obamacare, that the preservation of this weak individual mandate and all the other aspects of the law, all the other insurance regulations that the president touted at the White House the other day, those things sound nice in theory for the 1% of people who benefit from them. But for the 99% of people who do not, insurance will go up. And insurance is not cheap today. The average median household income in America today is $51,000. The average family insurance plan, as I mentioned, is $15,000. That's 29% of household income. In the last year alone, the price of insurance went up by 9% because of Obamacare's regulations. This will continue to go up. Think of if your tax burden went up 9% a year for the next 10 years. What would you say? But yet, that's exactly what Obamacare is. It's not a tax. It's forced allocation of your own money to insurance and health care. And that is ultimately the biggest problem with this law. I'm going to briefly touch on one other thing. The Supreme Court, as others have noted, allows states now to opt out of the Medicaid expansion in the law. By this keystroke of John Roberts, he may have expanded the federal deficit by $500 billion over the next 10 years and expanded our unfunded liabilities by trillions. The reason for this is that the law expands coverage in 2 ways. One, by expanding Medicaid, the existing program for the poor, and also by creating these new subsidized exchanges for the states. But the eligibility for these 2 programs overlaps between 100% of the federal poverty level and 138% of the federal poverty level. And the exchanges are much more generous. They spend a lot more per person than Medicaid does. And it's all federal dollars, whereas state is shared broadly by the states and the federal government. So states have an incentive, particularly those states that currently have very generous Medicaid programs, to pare those programs back, put all those people on the exchanges where they'll get much more generous coverage at the expense of taxpayers in other states. And Douglas Holtz-Eakin, a former director of the CBO who was brought up earlier, he's estimated that this will cost, it could cost as much as $1 trillion over 10 years, but a more realistic mid-case scenario is that it's $500 billion over the next 10 years. And so John Roberts didn't just reinvent the definition of taxation. He also added $500 billion to the deficit last week. Finally, I was asked to talk about what are the real solutions? What are the solutions that Governor Romney is promoting and offering and proposing? And what should those who believe in market-oriented solutions seek to achieve in our healthcare system? I think the most important first principle to understand is that there's a lot of misunderstanding about American healthcare. We often hear this rhetoric from our political leaders that American healthcare is the best in the world, and there was nothing wrong with it before Obamacare. Well, it's true that American healthcare is very good in many ways, but there were many things wrong with it before Obamacare. Before Obamacare, government spent half of the healthcare expenditures in America. Before Obamacare, the United States federal and state governments spent more per capita on healthcare than all but 2 other countries in the world, Luxembourg and Norway. We spend more per capita, our government spends more per capita on healthcare than France, Canada, the UK, Germany, all these countries that we think of as the socialist utopias, their governments spend less on healthcare per capita than the United States. So this is not a system that's sustainable. It's a system that requires real change. And the principal theme, I would say, of Governor Romney's proposals is put individuals and localities in charge of their own health dollars again. With Medicare, put seniors in charge of their own health plans. Let them choose a plan that's right for them and spend more if they want a more luxurious plan and keep the savings if they want to spend less. With Medicaid, let states and individuals control their own Medicaid dollars. And with the private insurance market, we need to move to a system where people own their own insurance plans instead of having them determined for you by where you work. Because that's the way to shop for value. If individuals own their own plans, they can keep them when they change jobs. You can keep your plan when you lose your job. You can shop for the plan that's right for you instead of buying the inflated, overly expensive plan that your HR bureaucrat chose for you. And in that way, we can truly start to move to bring the cost of insurance down. And if you bring the cost of insurance down, you make insurance more affordable, and you put more people can afford to have insurance, and you reduce the uninsured problem the right way by bringing the cost of insurance down. With that, I will yield to questions.
Well, thank you very much. As you were talking about homeowners' fire insurance and adverse selection, I'm reminded of the fact that the first or second homeowners insurance sold in the United States was by Benjamin Franklin in Philadelphia, and he charged people who lived in brick houses less than he charged people who lived in wooden houses because the risk was lower. So exactly, start right there, yellow shirt.
Thank you. Annabelle Fisher. I'm a licensed independent clinical psychotherapist. So I would like each of you to outline an insurance plan, healthcare plan, that would be acceptable to all of you. Because if we're all going to pick our own, and docs are dropping out of accepting Medicare and Medicaid, what health insurance plan would each of you design? Won't cost a lot of money for the patients and families.
I would wholeheartedly agree with what Michael Tanner just said. There is no one-size-fits-all. Healthcare is very personal, and we all have different levels of risk tolerance. We all have different needs in terms of maybe some people in our family do have health conditions that require more comprehensive insurance. You don't want the government dictating that. That's point number one. Having said that, it is true that in America in general, we do have a problem of overinsurance. Too many people have comprehensive insurance plans with benefits that they don't need. It's like Imagine a world in which we all went out to eat every day to fancy restaurants instead of cooking for ourselves and going to the grocery store. Obviously, if we did that, our food consumption would be a lot more expensive, but not with a lot more nutritional value. And that's true with our health insurance as well. We buy these very expensive plans that are far more expensive than we need. I think most of us in this room would agree that more people than are currently should be on high deductible plans with health savings accounts. We should encourage people to save money for their own health care, because that creates the virtuous cycle where you get rid of the moral hazard. If you save for your own health care, then you have an incentive to practice healthy habits because you're paying for it in the end if you get sick. So it would be great to move to a system that encouraged more people to get those kinds of plans. And if you got government out of the way, you'd see more of those kinds of plans.
Yeah, Eyal Moses, no affiliation. My question is, Michael Cannon has pointed out how states could stop large parts of the law by refusing to set up the exchanges. But my understanding, the insurance regulations part, the community rating requirement, the individual mandate will not be stopped by that. And so they can still effectively destroy, our health insurance. My question is there any realistic way to stop that? Assuming Obama gets reelected as president, under that assumption, and perhaps Republicans keep control of the House, take over the Senate, but not with veto-proof majority. So if repeal is not an option, is there any other realistic way to stop the insurance regulation?
Well, so you know how, with the Eurozone crisis, right, nobody wants to let the Greeks just go. Instead, they're trying to actually have greater fiscal union, right, to preserve the euro. That's what's going to happen if the president is reelected. So they're not going to get rid of the law because they're worried about the private insurance market going away. That is not what they're going to do. They're going to triple the fines associated with not buying insurance, or multiply them by 5. They'll increase the fines, or they'll auto-enroll you in government-approved insurance plans to make sure that you stay in the system. They're not going to unravel their prized regulatory architecture just because a few companies go bankrupt, not in the least. So the only way to get rid of this law, if you really want it to go away, is to elect a Republican president, a Republican Senate. Sorry.
I'm Bill Klein. I'm a retired Army physician. I'm curious in all this discussion, both from the point of view that you're proposing and also from your adversaries on the left, when all the dust settles, whichever one wins, what's going to happen to the military medical care system, which includes the hospitals run by the uniformed services as well as the VA system?
I can talk about that if you like. I'm really glad you brought this up, because it's little appreciated that one of the fastest growing items in the defense budget is actually health care. Not just the Veterans Administration budget, which is actually separate from the Defense Department budget, but also Defense Department health spending, both of which are going up considerably. And because they're separate systems from the conventional healthcare system, if you want to call it that, it doesn't attract as much attention. But it's a considerable issue, and there's been a lot of complaints from people who've come back from Iraq and Afghanistan that the plans that they're on are inadequate for their needs, or because they served in the military, that the promises that were made to them when they came into the military in terms of health coverage are not being met. I personally think that there's a lot that can be done to integrate the military and VA health systems into the rest of the healthcare system. In the era of World War II, when we didn't really have the healthcare architecture broadly that we do today, it made sense to have a system of VA hospitals that were specialized. I'm not sure that makes sense today. I think it would make more sense to say, if you are a veteran, we'll give you a certain amount of money, a generous amount of money, to buy your own health insurance plan, and choose, that plan can then choose to have you treated at the VA hospital, at any other hospital. And if we do that, not only will we give people more freedom and more choice, but we'll also create more competition among healthcare providers, which is a big problem in the American system, is that we complain. People like to blame the insurance companies because healthcare is so expensive. The insurance companies are the messenger. The reason healthcare is expensive is because hospitals charge insurers say, you know, we're going to jack up our prices 25% this year, and if you don't do it, we're not going to take any of your beneficiaries. But if the VA hospitals could compete and say, hey, we can provide more efficient care, or the private hospitals could say, hey, we provide more efficient care, you have that element of price competition and quality competition that would benefit both sides of the equation.
My name is Jim DeLong. My current identity is the author of a book on why we don't have a welfare state, we have a special interest state. And that's my question, in that I haven't heard you discuss where are the big players and the corporate players? Where are the hospitals, the doctors, the insurance companies, pharma that we've all read about recently? And how are they going to participate in this little political debate we're going to have over the next few months?
I just simply say that a lot of industry stakeholders don't favor free market reforms for this simple reason. We spend more per capita by far on healthcare than any other country, both public spending and private sector spending. If there's a market-oriented system that encourages individuals to allocate their money more efficiently, a lot less of that money is going to go to healthcare, QED.
My name is Peter Boetsma. I'm the health counselor with the Netherlands Embassy. I would appreciate if Mr. Roy could elaborate a little bit on Governor Romney's ideas on healthcare. Should the, let's say, the healthcare law being repealed under this administration?
Sure. So there's, as I said in my formal remarks, if you can call them that, the main theme is to give individuals and localities more control over their own health dollars. So if I'll divide it up into 4 parts. So with Medicare, the goal is to do something that's similar in character to the Wyden-Ryan plan, which you may be familiar with, which involves, again, giving seniors the choice of health insurance plans, and both private insurers and the traditional fee-for-service government system would compete. Within that, they would bid for your business, and they would say, we're going to cover this set of benefits for this price. And whoever, whoever set, there would be an index, so maybe the average price would be tabulated, and then if you purchased a plan that was lower than the average price, you would save money. If you purchased a plan that was over the average price, you'd spend a little more. But that way, there would be a market pressure towards being more cost efficient in your insurance plans. With Medicaid, the idea is to block grant Medicaid to the states. This was a very successful approach to reform that we used with welfare in 1996 that has been hailed by both sides as a tremendous success, because right now the program is micromanaged out of Washington but sort of managed by the states, and Washington actually the Washington bureaucracy prevents states from enacting simple common sense reforms that will allow them to allocate their Medicaid dollars more wisely. I'll just give one example. So in Illinois, a state run by Democrats, Illinois is under a huge budget crunch right now, and as part of that budget crunch, they were trying to reform their Medicaid program, because Medicaid is the #1 item in their budget. So they try, right now in Illinois, you can't check a Medicaid applicant's residency status or their income status. Basically, if they submit to you a piece of paper saying they live in Illinois, or they have a certain income with one pay stub, and of course pay stubs can go up and down, so one pay stub doesn't tell you your income, and they didn't have to prove their residency. So they passed a law saying you have to show 4 utility bills to show where you live, and 4 paychecks, so we can get a sense of your income over time. The Department of Health and Human Services in Washington blocked that reform, saying it was illegal now under the Affordable Care Act. This is, again, a Democratic administration in Illinois. So those are the kinds of things that block granting would get rid of. States would be able to run their programs more efficiently. Then with the private market, the idea is to eliminate the tax discrimination in the tax code right now. So right now, because of these wage controls we talked about earlier, if you get insurance through your employer, you don't pay any taxes on that. But if you buy insurance for yourself, you're doing so with after-tax dollars, after you've already paid your income tax and your Medicare tax and your Social Security tax. That makes health insurance for the unemployed or for people who don't buy insurance to their jobs very, very expensive. So you want to change that so that the tax break is equal for people who get it through their employer and for people who don't have that opportunity, because that way you can buy your own plan, you can keep it when you change jobs. If you're unemployed, you still get the same tax break, or if you're freelancing, et cetera. So that's a big, those are three things, plus reform of medical innovation, making sure the FDA is doing a better job of getting innovations to market. That's a big part of what the American system does well at its best, and something that left-wing health reforms completely ignore, the role of innovation in making healthcare better for everyone.
Without putting too fine a point on it, when I hear Governor Romney talk about health care, I would describe my attitude as skeptical. Not when I listen to Avik speak about health care. One of the things that concerns me about Governor Romney is that when he talks about what he would do when he becomes president, on the first day, he would work to repeal Obamacare, including by giving, I think that's fantastic, but when he says including by giving states waivers from Obamacare, I don't think he can really give states waivers from Obamacare the way most people understand that. He doesn't have, the president does not have that power. I get concerned because I think what he might mean is that he would give states waivers like he got from the Bush administration when he put Romney Care into place in 2006, which was the model for Obamacare. So I'm not asking. I mean, Avik can respond to that if you want. I'm concerned when I hear that from the governor and from the Romney camp. Just offer that. I'm not sure that it makes me wonder whether Governor Romney really understands that the danger that Obamacare poses.
I want to ask a question too, to see if Avik can answer, because I'm concerned as well. I mean, look at the list of things that I talked about. $500 billion in new taxes, $500 billion in Medicare cuts, the Independent Payment Advisory Board, the employer mandate, the exchanges. He can't waive those any more than the president could just decide he's going to ignore immigration law that the Congress has passed. So I'm very concerned that he's saying he can sort of wave a magic wand when you actually have to have statutory changes to make the changes he wants.
So let me put everyone's concerns to rest. The governor's point about the waivers is, first of all, what if there's a Democratic Senate? There's no guarantee that we're going to have a Republican Senate. So the one thing he can do as president without the assent of Congress is to do as much as possible to liberate states from the new regulations that the Affordable Care Act imposes upon them. And that's what he means when he talks about the executive order. He certainly, and has stated explicitly over and over again, that he will sign a repeal bill as soon as there's one on his desk. And I can tell you, before I joined the campaign as an advisor in my capacity as a Forbes blogger, I wrote a piece saying, is Romney committed to repealing Obamacare? And within 10 seconds, the Romney campaign's press spokesman was on the phone with her chief of policy, demanding to know how I could have written that, given that the governor has stated repeatedly that he wants to repeal Obamacare. And I explained, well, all these sorts of things, blah, 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 this thing about the waiver, some other things. And they said, listen, he wants to repeal Obamacare. I said, well, what about reconciliation? Is he in favor of repealing it via reconciliation? Because one of the things they told me was, well, we don't know if we're going to have 60 votes in the Senate. So, and the policy advisor had said at that time, well, we don't know if we're going to be able to we don't know if we can repeal Obamacare via reconciliation. That's a hypothetical we're not prepared to answer. The next day at a candidates debate, I believe in North Carolina, Governor Romney stated that he would repeal Obamacare via reconciliation if he had that opportunity. So I am very convinced, 100% convinced, that the governor is committed to repealing Obamacare, but we have to do the hard work of giving him a Republican Senate.
Well, I'm not convinced. I'm not convinced. But let me tell you what would, and I don't mean to be dumping on Governor Romney, because certainly the president has been very duplicitous about health care reform. He was against an individual mandate before he was for it. It was a tax, and it's not a tax, and it is a tax, and it's not a tax. But let me tell you what would impress me if I heard it from Governor Romney. If he said that his first act as president would be to rescind the IRS rule that tries to rewrite the Obama health law by issuing those health insurance tax credits and cost-sharing subsidies in a federal exchange where they are not authorized, and thereby taxing employers who would otherwise be exempt from the mandate. We have the IRS has actually issued a rule that without congressional authority, taxes employers spend could spend potentially hundreds of billions of dollars without congressional authority, all to save the Obama health law from this gaping hole in it that I discussed earlier, states don't create exchanges.
Mike, let me just stop you
If
there
you-
and say that the campaign is well aware of your excellent work in this area.
So let me recap and say that would be an impressive signal that the governor is really committed to getting rid of this law.
Michael Willey, disappointed libertarian. Just wanted
Are
to,
there any other?
But you
I was
repeat
gonna say.
yourself.
we all are today. I just wanted to go off what you said about Illinois. I recently worked at the Illinois Policy Institute, and we did some work on Medicaid. And at the beginning of the decade, we had 1 in 8 Illinoisans on Medicaid. At the end, in 2010, we had 1 in 5. If Obamacare is fully implemented, we'll have 1 in 3 Illinoisans on Medicaid, a system designed for the poor and disabled, crowding out essential services for them. How do we convince the governor, short of a mandate from the president, I think it might have to come down to, as opposed, as we all are, to mandates, to actually not go ahead with both the Medicaid expansion and, as he has also hinted at, an exchange?
Sure. So briefly, let me tell you the story of a 12-year-old boy who grew up not too far from here in Prince George's County named Diamante Driver. Diamante Driver was a 7th grader, lived on the wrong side of the tracks, you know, had the usual problems that 7th graders who live on the wrong side of tracks do. He was homeless from time to time. He grew up without a father. He was on Medicaid. His mother found out one day that he was complaining of toothaches, so she tried to get him a dentist appointment. But she couldn't find a dentist who would take him because Medicaid, in order to cover as many people in the cheapest possible way, pays physicians 58% on average, and in some cases much, much less than what they would get from a private insurer. So a lot of dentists, a lot of doctors don't take Medicaid. You have this card that says you have insurance, but you can't get actually an appointment with a doctor. So after a while, she finally managed to get a dentist who would see him. And he had 6 abscessed teeth. So he needed to go to a surgeon to get these teeth pulled out. So it took another 2 months for him to see a surgeon. It turned out the abscess by that point had spread to his brain. So he had to go to a neurosurgeon to get the abscess, the infection taken out of his brain. That took another month. By the time he was ready to have the appointment for the surgery, he died. This is a 12-year-old boy, poor, homeless, who died not because he was uninsured, but because he was insured by the government. I bring this up to say that you'll convince conservatives, of course, not to expand Medicaid because it busts the budget or because they have an ideological opposition to government programs. But the way you persuade Americans to be worried about this Medicaid expansion is to explain to them that health outcomes for people on Medicaid are in many cases worse than for those with no insurance at all, and far worse than for those with private insurance. And the real way to address the problem of the poor is to reduce the cost of private insurance and redirect Medicaid dollars so that they have access to high-quality private insurance. Health insurance is not the same thing as health care. And if we really are concerned about the poor, what we need to do is get them out of the Medicaid safety trap and give them access to better health care.
Well, thank you all very much, and thank you to our panel. I don't think we could have had any people who know more about this healthcare law. Thank you all for coming into this nice, cool auditorium out of the heat, and we have a reception outside. Thank you all very much.
Very nicely done. That was a perfect note on which to end.
Live streaming.